Prostate cancer. Let's break down how it starts, how it spreads, and how doctors treat it. The prostate is a small gland, about the size of a walnut, that sits just below the bladder in males. Like every part of your body, it's built from billions of tiny cells. And inside each of those cells is DNA, the instruction manual that tells the cell exactly when to grow, when to divide, and when to stop. How cancer begins. Normally, cells divide in a calm, orderly way. One becomes two, and only when the body actually needs it. But sometimes the DNA gets damaged. We call that a mutation. When it happens, a cell can stop listening to the stop signal. It copies itself over and over, out of control. And that growing pile of extra cells is what we call a tumor. Growing and spreading. At first, the tumor stays inside the prostate and caught at this stage, but it's usually very treatable. But what happens if it keeps on growing? Some cells can break away and travel through the bloodstream and to other parts of the body, most often the bones. This spreading is called metastasis. Moreover, let's now look at the signs and symptoms. As a tumor grows, it can press on the tube that carries urine, leading to signs like needing to pee often, especially at night, a weak stream, blood in the urine, or aching in the back and hips. But here's the catch. Early prostate cancer often has no symptoms at all. That's exactly why screening matters. Good to note how it's found. It usually starts with a simple PSA blood test, which checks for a protein that can signal a problem. If it's high, the doctor does an exam and an MRI scan. To confirm, they take a tiny sample, a biopsy. From there, they grade how aggressive the cancer looks and stage how far it has spread. That's what guides the treatment plan. Moreover, here are the treatment options. There are several ways to treat it. Slow-growing cancers might just be monitored closely. Others are treated with surgery to remove the prostate or radiation to destroy the cancer cells. There's also hormone therapy and chemotherapy. The right choice depends on the grade, the stage, and the patient. And caught early, prostate cancer is very often cured. Hormones and medicine. Here's a key fact. Prostate cancer usually feeds on a hormone called testosterone. So one of the main treatments is hormone therapy, which turns that fuel down to starve the cancer. Medicines like leuprolide, enzalutamide, and abiraterone lower or block that hormone, often combined with chemotherapy, like docetaxel, if the cancer has spread. So here's the big takeaway. Prostate cancer starts with a single DNA mistake in one cell. But when it's found early, it's one of the most treatable cancers there is. Thanks for watching and keep learning.